And welcome back to the show. Whether it's a problem with alcohol, opioids, or any other substance, substance abuse actually kills thousands of Americans every year and impacts millions of lives. Care for the Homeless is an organization that's bringing essential medical, mental, and behavioral health care to people who are experiencing homelessness in New York City. Here now and sharing more details, we've got the substance abuse counselor at Care for the Homeless, Luis Fernandez. And Luis, thank you for being with us. And tell us a little bit about where we are today, because as we're navigating this COVID pandemic, I know for a fact that the use or substance abuse continues to be on the rise.
Yes, it is, and one of the main problems that we're having is the increase in uses of fentanyl. Is a very powerful opiate that is being produced now in the streets, and um, the problem with the fentanyl is that it's killing a lot of people out there in the streets. There's a lot of overdoses that we encounter almost every day. Um, but we do have some treatment for it. Our Suboxone program has been able to curtail some of some of the overdoses, and we also, do a lot of street outreach in the streets. So we basically go out to the streets about 3 days a week in the South Bronx, especially around 3rd Avenue, 149th Street. And we just take them out of the streets and bring them into the shelter system. Right now, we are operating out of 800 Barreto, and we coordinate our whole services also with Bronx Works. Whereas guys in the street, the first thing that they want is a room, right? They usually don't talk about substance use. When you want to approach them about, how can I help you with with your problem? First thing they want, can you help me get a room? So what we are able to do now, and we've been very successful, is, we are able to provide them a room at that moment, but with the condition they come in, and we are able to provide them with, with the medical, mental health, and also the substance abuse programs that we have, which is right now is the MAP program, Suboxone program. And, we've been very successful with it, and but at the same time, when COVID came around, it was a shock to the nerve, to reality in a way. We lost a lot of people, and not only because of COVID, a lot of people were using. The usage got more intense when COVID came around, but it does fluctuate a little bit. But right now, we're getting much better with it.
I know that when you talk about the work that you do, dealing with the homeless population, those who are involved in substance abuse, very intense, very critical work. So when you have people in the program, how is it in terms of retention? Are you able to retain a lot of those people who enter into the program? Do they stay, or are we saying, in, out, in, out? How's it working?
Okay, yeah. So our program, like the Suboxone program, has really been successful, but right now it fluctuates, right? Sometimes we get a person for a week. Sometimes we get them for 2 weeks. We have had some very successful clienteles that from the moment we started in 2016 up to now, they are still with us. And, if I could tell you their stories, they came in without nothing. And right now they are actually, full employed. They got their permanent housing, and they living a very healthy life. So we do have some success, but also there have been some struggles with it, because there's a lot of guys that are, sometimes they need more structure than the program can provide, and that's where the retention comes in. Is that it fluctuates, sometimes.
Yeah. So when we talk about services that your organization provides, why don't you walk us through a little bit more about what's available to those who come into under your doors?
Sure. So we have Care for the Homeless has been in inception for 35 plus years. We have brought essential medical and mental health, behavioral health care to people experiencing homelessness. We currently operate 27 health clinics throughout the 5 boroughs, and throughout the 5 boroughs. In 2008, we opened up a female shelter, for the mentally ill and medically frail. And as of 2008, we have been able to provide permanent housing for 1,000 of the females. We are currently, opening up another safe haven site in Morris, right across the street from Lincoln Hospital. And we also have another site, just like the one in the Bronx for females, 52nd Street in Manhattan, which also provides the same services. Care for the homeless, basically, if you come in, if you got Medicaid, if you don't have Medicaid, we will provide you services with medical, mental health, whatever services you need, medications you need. We are walk-in services 5 days a week. If you need to see us, if you have an emergency, you could call our number, 212-366-4459, and somebody will be able to help you out in less than 24 hours.
And so for people who want to know, you have people who come under your doors, they need help, you're able to help them. But sometimes folks don't make it under the door. And families have to deal with this at home. So what advice do you have for a family member that may be having a loved one that's actually dealing with this substance abuse issue? How could they go about being of best support to the person that's really using and abusing?
Well, I encourage everyone and anyone in the city that if they need any help, to call our number. They also, the city has some hotlines that people could call, but it's basically, because when the family is involved with someone that's having a problem, the family's having a problem also, right? So they're part of the addiction. So, the best advice I could tell them is that to either call us or call the city. The city, they have the website is nyc.org. And they could call the city or call our agency, Care for the Homeless. We will be able to provide them services. Like I said, there's no need for, if they don't have insurance, that's not a problem. And basically, and we treat people with kindness, respect, and they will get the 100% support from us.
Yeah. Well, Louis, we're going to leave it there, but thank you so much for sharing. Thank you for helping those who are really the most vulnerable in a time like this. And sometimes we don't pay attention to how bad it is, given the fact that we've got so many other things we're navigating through COVID, but substance abuse, a really big problem for so many people. Glad to have people like yourself there helping out. Louis, we thank you so much for being with us.
Thank you. Appreciate it.
All righty, Louis Fernandez, our guest here on Open. He is working with the area of substance abuse counselor at Care for the Homeless. Now, if you want more information about Care for the Homeless, well, go to their website, careforthehomeless.org, and you can find out just how you or a loved one can receive some assistance. Taking a quick break, we've got more Open. Don't go anywhere. We're coming up right after this.